Good afternoon, Dr. Francisco. What is your current utilization rate for COVID-19 patients in the lung center?
Good afternoon, Sean, and good afternoon to all our listeners. Yes, Lung Center of the Philippines is a 200-bed capacity hospital, and right now we have dedicated 55% of our beds to COVID cases, of which 80% has been filled up as of this morning.
And from the total number of confined COVID patients in the lung center, Doc, around how many cases are severe and how many are mild, just roughly?
We don't admit mild cases because Lung Center is a facility designed for moderate at the very least and mostly severe and critical cases. So we have ICU or critical care beds numbering 61, and 51 of that has been filled up this morning, and that's 84%.
All right, now having said that, Dr. Francisco, do you agree with the Health Department's proposal to just confine mild and asymptomatic cases in quarantine or isolation sites in communities instead of hospitals to decongest?
Yes, for as long as they are being monitored, because we are in constant communications with facilities, and the moment there's any deterioration or progression in any of their quarantine personnel, they bring them to the hospitals right away.
All right, how would you compare, Doc, the current bed occupancy rate this time around at present from the rate in August last year when COVID-19 cases also peaked?
We had more in August and also in March of last year. At the time, we dedicated 75% of our beds to COVID, and even our emergency room was filled up by then.
All right, so is that a function of the hospital, just improving protocols and logistics within, or is it because the cases are really not as severe as it used to be?
I think it's multifactorial. We've learned a lot after 1 year's experience, but at the same time, we cannot control how the virus and how the individual respond to the infection. Whether or not one will get a severe case or not is always an interplay of many factors, notably of which is the host immune system, the virulence of the organism, and the prevailing environmental conditions. So one example of that is the viral load in the community where these individuals are. So all of these are always coming into play, and it's always an interplay of factors. There's unlikely one single factor that's responsible for this.
All right, so it's hard to qualify that or even
it's
quantify.
Very difficult, but what we have learned very much is that the earlier one gets treated, the higher chances is that individual has of surviving.
All right, noted on that, Doc. Now I have to ask, how is the vaccine rollout going in the Philippine Lung Center?
Well, we've had 77% of our employees vaccinated already. The few ones that have not been vaccinated had valid medical reasons for the delay, but we can still go after them over the next 2 weeks.
All right, that's really good to hear, Dr. Francisco. Are you also in favor of the proposal made by Health Secretary Duque to administer all on-hand vaccines as a first dose instead of holding on to them as a second dose for those who already received the first jab?
Yes. For as long as we continue to have negotiations for a constant supply, then it's best to be able to vaccinate as much as we can.
All right, noted on that. Thank you so much for your time and your opinions, and your insights. Dr. Norberto Francisco of the Lung Center of the Philippines.